Hey guys, Dr. Jeff Finley here.
And Dr. Jessica Finley.
Low back pain. It's something most of us have dealt with it at least some point in our life. If you're fortunate enough to never have dealt with it, lucky you. But let's look at a few predictors of what may be causing low back pain, at least according to the research.
So, number one, we're going to talk about lumbar lateral flexion. This is the ability of your lower back, referred to as the lumbar spine, to bend side to side, okay? So what they found is that with decreased lateral flexion, bending side to side, there's a higher likelihood of developing lower back pain. So what do you do to improve this? Stretching is a great way to start, but the best thing that you could do is getting an adjustment. So we have already covered some research topics that talks about the benefits of getting adjusted and how it improves with range of motion.
Number two, hamstring flexibility. Now this may seem like a very simple idea, but it's actually a very complicated issue. And that's because even though with more hamstring tension comes low back pain, hamstring tension is not always as simple as, well, you just need to stretch more. Many times you can get increased tension because of a rotated pelvis. You can get it because of weak glute muscles, weak quadricep muscles. All of these have to be considered as to what may be causing the tight hamstrings, not just you need to stretch more. So the best advice we have for this one is, of course, try stretching, but if that doesn't work, you need to get evaluated by someone who's qualified to look at it. This can be a chiropractor, a physical therapist, or even a well-trained personal trainer should be able to look and evaluate for different weaknesses or contributors for hamstring tension.
All right, so number three, we're going to talk about lumbar lordosis. Now this refers to the curve of your lower back. This is best seen on x-ray. What they found is if the curve is a straight line or just a slight curve instead of what the normal curve should be. Sometimes this is evident just by looking at someone's low back, but sometimes it's really hard to tell. But some things that you can do to improve the curve of your lower back is by getting a massage to help reduce muscle tension or muscle spasms. The other thing that you can do is strengthening your core muscles, which isn't just your abdominal muscles. You want to be working with your glute muscles as well. And of course, getting adjusted.
Now, it should be clarified that when we're talking about the curve in your low back, we're not referring to a scoliosis curve. So the curve that we're actually looking at, instead of looking at your front from the spine, would be looking at it sideways. It should bow forward slightly. That's actually what we're referring to when it comes to a lordosis. Now, all of these things that we just talked about are not the only contributors to low back pain. Simply what we were looking at was information that the research provided us with. Now, this is reassuring because they've looked at lots and lots of clinical studies to determine this information, so it allows us to evaluate for these things and even come up with different treatment modalities that may address these issues either before low back pain comes about or once it's already there, a couple things to look for. The simplest thing that you can do that's going to help all three of these main categories is simply staying active. By being physically active, you're going to help keep the spine more mobile, aka helping you bend sideways, and it's going to help keep your muscles loose, specifically your hamstrings or even the muscles in your low back that may tighten and kind of flatten or increase too far the curve in your low back, or the lordosis as we refer to it.
So, if you have found ways to help with your low back pain or prevention of such, let us know in the comments below of what you've done. We'd love to hear from you.
So thanks for tuning in, and we'll talk to you guys next time.